everyone, and welcome to the Science North podcast, Give Vaccines a Shot, where we'll explore the latest in vaccine news, learn all about the global health pandemic we've been facing, and have an opportunity to learn about the importance of our immune systems. We'll be doing all of this through the lens of our expert guests. This month's guest is Farhaan Ladhani from Digital Public Square. Farhaan is the CEO of Digital Public Square, a not-for-profit organization with the University of Toronto that specializes in using digital tools for social good. Digital Public Square helps Canadians tackle the growing spread of misinformation online. It has done so through its games. Farhaan and his team are doing interesting things in digital spaces, and in our conversation together, we speak about the struggles of tackling the infodemic that has coincided with this pandemic.
All right. So as we talked about in an earlier podcast, we're living through what's called an infodemic. So too much information, including false and misleading information during a disease outbreak. A major issue is that this infodemic has led to mistrust in health authorities and has undermined our public health response. I have with me the CEO of Digital Public Square, a not-for-profit organization that specializes in using digital tools for social good. Welcome. Before we start, could you please introduce yourself with your pronouns and tell us a little bit about your background and your expertise?
Well, thanks so much for having me. First of all, my name is Farhaan Ladhani. I go with he, him. My background is in how to leverage digital tools to enable people to access better information, to engage with that information in order to improve the decisions that they take, and ultimately to create the conditions for how that information can foster better outcomes for communities and improve the quality of their lives. And my work in this space has been, like 20 years of how you go about leveraging online and digital tools to foster that improvement. We live in a pretty challenging time, and digitally one that seems to be going the direction that's not very helpful. And my work and that of the organizations is intended to try to make it better.
So we're talking about misinformation and misinformation online. What enables misinformation to get a foothold and perpetuate?
And that's a great question. I think the way I think about this is there's two parts to that equation. The first part is the part that I think everyone has a pretty clear understanding on, and that's the supply side. There's a lot of it. And the supply itself, I would say, is infinite, meaning that the cost of the production of bad information is low to nil. Mm-hmm. The technology to produce it and replicate it and scale it and have it grow and distribute it the cost is also very, very low. And so as a consequence, the supply, as I said, is infinite. And with advancements in AI and in new technologies, that challenge, I think, grows because it is easier, faster, cheaper to create and distribute that bad content, whether we call it misinformation, disinformation, or malinformation. All of them have unique characteristics, but collectively, that toxic information supply is infinite. And we could talk a little bit about, the effects of those things. I'd say the second part of that story is the demand side. That's us. What we consume and why we consume it, and what makes us intrigued by that toxic content. Some of it's designed to produce a particular behavioral response. It's intended to elicit, disgust, excitement, motivate your consumption of that content. And so we, as individuals, I think are really quite predisposed to both the attraction to that content, the consumption of that content, and then we're making choices and decisions on the basis of that content. And I think that's where this becomes really worrying. And I'd say the second part of that story is that on the demand side, a lot of this material is designed in a way to elicit those emotional responses, mm-hmm. What we call negative emotions sometimes. And I'll talk a little bit about that just for a second. You guys have all heard the story of the bunny, the bear, and the bush. You're rustling in the bush. You think it's a a bear, turns out to be a bunny, no big deal.
Right.
You're resting in the bush, you think it's a bunny, turns out to be a bear, you're in big trouble. And so those negative emotions have kept us safe for a really long time to avoid, a pretty problematic circumstances. Well, in the online space, those negative emotions and that response can be a real challenge to getting people to consider new forms of information. And then I'd say the last part to that, and there are many considerations, but the one that we think a lot about here is our desire to conform to our pre-existing beliefs. And so you guys have all heard about motivated reasoning, the desire to consume and to acknowledge information that already agrees with what we already think.
Mm-hmm.
Our brains just are a little bit more predisposed to doing that because it's easier. It's harder to think about things that challenge what you already know or what you already think or what you already believe. And so as a result, that content and information that conforms to those pre-existing views or validates them is stuff that we readily consume. And it turns out that misinformation that people use and consume oftentimes has that cluster of characteristics. It's really emotive. It might conform to their pre-existing beliefs. And so to break out of that, we got to figure out the demand side of the equation, which is about how do we make us better?
So at Digital Public Square, your organization, are you taking advantage of these qualities of misinformation, but using it for good?
Yes, some aspects of it. Some of this is how do we create the conditions for people to feel less stress in the context of the engagement with the content that's in the platform we've developed. And that platform is designed very much to confront some of these types of challenges. It reduces stress, meaning that it takes the negative emotions and turns it into a framework where we can leave you a little bit more open to considering accurate and good information. And so that's one thing that we're focused on with respect to the way that our work and our products function. So yes, it's counter to the way that kind of negative emotions torque up that stress. We kind of want to reduce it. The second thing is creating an environment where you are able to access high quality information, but in ways that are straightforward. They're intended to be clear. They're designed to be at a language level that everyone can access. And they try to make really complex things as consumable as possible and as accessible as possible so that many, many people have an opportunity to benefit from that content. And then gamification helps us enable opportunities for depth of engagement. So we want you to explore information and content because you feel like you're discovering it, because you feel like you are independently driving at the conclusions that are coming to you. No one's force feeding you anything. Mm-hmm. And rather you're creating space for people to both consume and then acknowledge that information on their own behalf. And that's really powerful and important because it creates a sense of agency. We think that's really critical for people when they're trying to make sense of the world around them. Most people are just trying to make sense of the world around them. And when they're trying to make sense of it, a sense that, I'm independently learning about this, or I'm learning about it from a community that I trust, are all important attributes for the way in which we do our work, because we think that that's the best way, frankly, for people to be encouraged to consider a diverse array of information and options as they arrive at choices that impact their lives.
You were talking about gamification. One of the games that I came across was called It's Contagious. Are you still using this game?
Yeah, so that was one of the first games that we produced related to the COVID-19 pandemic. And that the product is still live. We spent considerable amount of time, both on the research side as well as on the implementation side, to create the conditions for what we believe to be a more accurate reflection of the information available to people as they were making judgments about a whole host of issues with respect to COVID-19. Where did it come from? How does it move through society? What are some of the risks? How should we be considering those risks in light of public health policies? A whole array of issues that clearly the information was in high demand. When we initiated that work with It's Contagious, and this is now back in 2020, it was on the back of the really early days of the pandemic. Mm-hmm. We were tracking what was taking place in social media and the kind of conversations around this issue. What we saw was just an enormous amount of toxic and bad information. Some of it was, designed to be wrong and to create fissures in society, and others were just information that people thought was accurate, valuable, and good that they were sharing just turns out to be patently false. And so that mixture of content makes it a real challenge to combat. But we looked at several 100,000 pieces of content, and we found clusters of stories or narratives that were very commonplace and that many people seem to be consuming. And so we took that and packaged it into the framework that I've been talking about, the It's Contagious product, and we deployed it on all 6 continents. And what we saw was demand for more accurate information than on anything that we had ever produced. Just the volume of people that were interested in learning about what was happening around them was enormous. And that feels pretty obvious, but we saw it come out in the data as well. Mm-hmm. Thanks to support from Heritage Canada, we were able to take that product and deploy it in Canada, updating it on a regular basis with the information that was around us. So It's Contagious was distributed across Canada, and a couple 100,000 people actually engaged with the product over the course of several months. And so It's Contagious was a really valuable way for us to seek to engage people on this really important issue so they could take better decisions for themselves, but also to learn a great deal about where people's fears are. What are they worried about? What are the areas of information that they feel are not being well received or well communicated? Where are there large degrees of misunderstanding? And all of that insight can then be used by groups, communities, other organizations doing this kind of work, government and others, to inform the strategies that they take. So It's Contagious was a really powerful tool in helping to create space for better information, but then also for learning.
How did you distribute it? Did you have select groups that you were targeting, or was it sort of random?
So that's another really good question. I'd say it was both. We first undertook a study to better understand where there might be specific or significant information deficits. Where you see gaps in people's awareness or understanding around some of these issues, where there might be some disproportionate effects of mis and disinformation on communities. And that study helped us better understand what groups or what communities might in fact be disproportionately affected by that mis and disinformation. And so then we had that understanding as a benchmark. And then we had an understanding of what that disproportionality looked like across the country as well. And so we could look at those two things and say, okay, where can we generate the biggest impact? Where can we create the conditions for opportunities for people to learn in the biggest ways? And so we were able to leverage all sorts of methods for distribution. We spent a lot of time working with and engaging with groups that reach out to some of those communities and provided the tool to them. We work in the online space, and so we distributed the tool online, both organically and through sponsored posts, meaning that we were able to advertise online to be able to create the conditions for people to encounter the product as part of their news feeds. And collectively, those strategies enabled us to reach a whole host of communities that we feel were across the spectrum, from people who were really well informed to people that had some real questions about the information that they were consuming in the whole entire ecosystem.
And then how did It's Contagious transition into your other game, Know It or Not?
Yeah. So that work that we did in 2020 taught us a lot, actually, about the impact that we could have with a product like this and with an approach and methodology like this on science communication. But importantly, I would say on vaccines and hesitancy. One of the things we learned coming out of the series of research that we did, both on the efficacy of the product and then how that product performs in helping people understand information or consume information at its most broadest sense. What we learned was that it was having a positive effect on increasing or reducing hesitancy, I should say, meaning that people in a series of research trials that we ran suggested that it reduced hesitancy and improved the likelihood of vaccine adoption.
Mm-hmm.
And that was back in 2020. And so in 2021, we engaged with the Public Health Agency of Canada to see if we could take some of that learning and the product and apply it to the challenge of vaccine hesitancy, and particularly where mis and disinformation might be fueling some of that hesitancy on the back of bad or toxic information. And so since then, since mid-2021, we have been advancing on a project to take the product and deploy it in the context of a whole host of communities in Canada that may be disproportionately affected by mis and disinformation related to the vaccine that could have an impact on their desire to take the COVID-19 vaccine, ask questions about the things that concern them, and ultimately to make better choices around their own desires to adopt the vaccine and those of their family and friends. And so since then, Know It or Not has been distributed across the country, and we're focusing on a whole host of communities where there are real gaps. So for example, there's a lot of good questions out there around the both efficacy and the appropriateness of the vaccine amongst 5 to 11-year-olds. Parents admittedly are going to be really worried. I was worried. All of us have these concerns, and figuring out how to access information in ways that allow us to then get the right resources that help inform the decisions we take was a particular area of focus on Know It or Not. And so some of the groups that we're trying to engage, both through outreach and directed engagement, as well as the online space, also benefit from some of those very early sets of research that we did, and then updated research to understand which communities might be most affected. And so Know It or Not is designed very much to address vaccine hesitancy as its core consideration, and trying to provide people with better information so they can make better choices.
And you're saying you provide the game through outreach. Is it entirely digital, or do you have sort of a paper copy that you do as well?
No, it's entirely digital. We stuck to the truism in the name here. In the context of this version of the product, we have done work for offline environments and devices, and we've prototyped a few ideas around how you might take some of the work that we've done and apply it to paper and pencils. But this product was very much focused on digital. And what we learned actually from some of our work in recent years has very much been that some of the biggest challenges are in the online space, where we're seeing a lot of high degrees of consumption of this content, of the bad and toxic content. And so as a consequence, it was a natural place for us to be in seeking to create the greatest impact that we could. Right.
So you're seeking out your audience where they're getting the misinformation from.
Meet them where they are. It's a key aspect of the work that we do, which is meet people where they are.
Is this it's Contagious, Know It or Not? Are these the first time that you've used gamification to address social issues?
No, we've been doing this for years. We've done many versions of this over the course of the last several years, and each one learning from the last. And so we've been iterating on a framework for how to foster opportunities for people to have meaningful conversations, usually on tough or difficult issues, and oftentimes in challenging places for years and years. And so these are the latest iterations of what we've been learning over several years as to how to motivate participation on these issues and really draw people in. So much of communications for many years has been how do we push information out, just get it out there and make it available to people. And we live in a deluge of information now. If you just step back and you think for a moment about how much content we're either exposed to or consume today than we did 30 years ago, it would blow your mind. And so that availability is enormous. And that the problem of that availability is that it's all around you. What you pick and choose starts to really, really matter. And so our approach has very much been, how do we draw people in to participation as opposed to just pushing information to them? And gamification has been a really useful way to help enable that opportunity to pull people in so that they can, on their own terms, get into those conversations.
And we've been talking about us at Science North and with our colleagues and other experts about the fact that there is so much information, and just giving that extra bit of information. We always think, oh, if we just give them that other study that will convince them, but that's not what it is. It's the whole camaraderie, the building of trust. And how challenging is it for you to build trust online with a game like this, or games like these?
So I'm going to answer that a couple of different ways, if that's okay. One is, I think we've got trust issues that have been going back for decades. And if you look at the data and the studies, it's pretty clear. We're on a downward slope here. And there's a whole bunch of reasons, I think, as to why that's the case. But we've seen trust erode both between people and institutions, but also between and amongst communities. And I think this is happening in our society today. And I think that the pandemic has very much exacerbated some of those gaps and fissures that we've seen emerging over many years. And this is a challenge, I think, for societies around the world. It's not unique to Canada, but it certainly does exist here. It is a challenge for societies that are both, very homogenous, and those that are heterogeneous with many, many different people. And so I think this is a really significant global challenge. And I think we've seen as I said, the trust issues growing, meaning that trust is actually diminishing. So that's the backdrop. I would say that backdrop makes it even more important to figure out how to actually build trust. And we know the good ingredients to that. It's just happens to be really hard, and it happens to be really difficult to scale. And so those are the kinds of things that we've been focusing on. How do you foster genuine moments of discovery where people feel like they're independently learning something because they're coming to conclusions as opposed to being fed a bunch of information? So we talked a little bit about this before. That's a really important aspect of building trust. Transparency in the work that you're doing and why you're trying to do it, and acknowledging that you are doing it are important parts of that story. And so we try to do that in the context of the information we provide and the way where it comes from and how it's reviewed. So that's all happening as well. And then how do you create the conditions for communities to own this? Not that it's a central repository, but rather communities that are customizing it for the needs of the members of their communities, because that's where people feel the highest degrees of relationship trust, right? They're with people that you feel kinship towards. They're with people that you trust their information. They're with people who feel similar about issues that you might feel upset about or worried about. And we work with communities to help co-create some of the way in which the content is developed and how it's articulated and how it's intended to be communicated, in order for them to have ownership over that material, so that they are better they're better equipped to share it with members of their community with whom they already have some trust. And so we find that those are really important ingredients in fostering trust. It's not just about what the material is, but where did it come from? How did you get it? What's your agenda behind it? All of those things are part and parcel of taking an opportunity like this to try to build trust with people who we hope will find the information valuable, and then it'll inform the choices they make.
Sounds like you're able to customize the experience for each of the communities, which is very important for that trust building.
That's our goal. It's not easy, and we strive to do as much as we possibly can. And in fact, over the next several months, our work on that's going to increase, and we hope accelerate in trying to increase the level of customization as well for community needs, because we're finding that the results of the work that we're seeing is that, appropriately, where there are significant trust gaps, those are going to be the hardest challenges to be able to address for people to consume and trust the content around them. And so we're very much focused on how do we further customize the work that we're doing in order to create the conditions for people to feel that sense of ownership I talked about before. And that's work that we continue to try to improve on, and will be over the next several months as well.
What are some challenges involved when you are gathering private information and how do you do it in a sensitive and inclusive way?
And it's an enormously important issue that we focus on. And our view on this is you make it core and central to the mandate. We don't add privacy considerations as an additional thing that we worry about. It's actually core to the way in which we do our work. And so today we take no personally identifiable information as people are engaging with Know It or Not. You don't have to tell us about yourself. We don't track you in the online space. Those are important considerations. And I think that for many years, people thought that there was a trade-off between privacy and the quality of the experience. I just don't think that's true anymore. And what we decided to do instead was build privacy at the center of the effort and then build the product around those conditions. And I don't think we've had to make a significant trade-off. We're learning great deals around where have real concerns about where information continues to hit a brick wall. We've got visibility on areas where we are seeing reconsideration of people's pre-existing views and like I said, where they have challenges. And it doesn't matter if we know who a single individual is, because we're looking at this across society and across communities. And so we can look at these results in aggregate and inform a great deal about the work that we do and that many others do. And so we really focused on putting privacy at the center of the experience and as a consequence, built around that framework. And I think that to the extent that there are some trade-offs, I think that in the grand scheme of things, I certainly believe that they're well worth it. And as a consequence, we default to that position virtually every time. And then from the perspective of inclusion, because those are not the same things, it's really important that we are doing our level best to engage with communities that are deeply impacted by these issues, to learn from them and to learn about the way that they experience these issues in their own communities and amongst the members of their communities where they're really worried and they're scared because they're not sure what information to trust and why they should trust it. And so learning from them helps us a great deal to create the conditions for both the product and the way in which we do our work to be informed by where those stressors are. And in doing so, we hope to reduce them to the greatest extent possible. But by including them in the process right from the get-go, we hope that ultimately produces a much better outcome, both in terms of participation, but then beyond that, into the way in which they consider the information that they're consuming.
Do you have some concrete examples of the impact of the game?
Yeah, so I can tell you today that more than 4 in 10 people complete it, which is kind of an enormous figure if you step back and consider what it's like to spend 3 to 5 minutes on the internet doing just about anything. And that gives us a good indication that there's a desire to engage with the content. Another one is that we're not delivering just 1 or 2 pieces of good information. I think today we're on somewhere between 8 and 10 doses of good information that people are consuming. That means they're exposing them to lots of good high quality content. And that's important because there's a whole host of issues when it comes to things like vaccine hesitancy. It's such a complex issue with a bunch of interrelated factors. So it's not just one thing that people might be worried about, it's many things. So that creating the conditions for people to consume multiple pieces of content that addresses multiple areas of concern is a really important consideration for us. And then the way in which we go about looking at the impact side is we want to ask ourselves, are people actually increasing their confidence? And so we're seeing increases in confidence around the vaccine as a consequence of gameplay. So people tell us, for example, where their confidence is at the beginning of gameplay, and then they tell us what their confidence is after gameplay. And we're seeing the differences in those effects, and those are absolutely moving in the right direction and in at a volume that we're pretty happy about, where we're seeing about 30% of people telling us when they started off low confidence that they're moving in the right direction, and that's positive. So we're seeing the right signals. We're going to do more work on that as part of our effort. In the past, we've run randomized controlled trials to assess the effect of the products. You take same material and you put it in a survey instrument. You take the same material and you put it in the game, and you have people participate in one or the other, and you try to look at the differences between the two. And those estimations of differences give us a sense as to whether or not we're actually moving the needle in the right direction around impact. And in prior studies, they have demonstrated that they are in fact moving in the right direction. And we're going to be encouraged to do some of that work as part of this project as well, so that we really get robustness out of what we're saying is the impact that we're creating in the world. Because our goal is not is to certainly produce that impact, but we hope that others will learn from it as well, because this is a massive issue. You started off talking about the infodemic. It's enormous, and it affects just about every aspect of our lives. And as a consequence, we have to figure out a better way to improve our individual people's relationship to information, increase those literacy skills, challenge the information that we're consuming around us, and be open to a set of alternatives. And so to the extent that what we're learning can help inform how many of us try to tackle this issue, we think that's immensely important. And so we really do try to beat up the work that we're doing as much as we can and challenge it to see where the learning that we're creating is actually having demonstrable effect and what others might learn from it.
And that's the incredible thing, is that you're able to collaborate with other organizations and we're all working towards helping increase confidence and give people the information that they need to make the right decision for themselves with regards to vaccines.
Exactly. And so our contribution is let's do our level best to create that impact and increase that confidence, and then let's help by telling everyone what we're learning. So that they can hopefully learn from it as well. It might validate what they're seeing. It might invalidate what they're seeing. And collectively, we get to chip away at this problem, because I think this is going to be a whole of society issue globally that is going to have to come to the table and say, how are we going to change the ecosystem around us in order to improve both the quality of the information that we're consuming and then how we make decisions around it.
2 final questions.
Yeah.
What is the most challenging part of your work? And you probably mentioned a bit of it already, but
what's the most challenging? We want to do everything.
Right? Trying to figure out what it is that you want to do, but you want to do everything.
Yeah, no, I mean, look, it's being focused, I would say, and knowing full well that there are so many challenges around us that are right in front of us that have really big demonstrable impacts on communities, and you want to do as much as you can on every one of those issues. And I'd say that one of the hardest parts is staying focused and knowing that while that's where you want to go, you have to start chipping away at these problems in a focused way, so you really understand whether or not you're doing good things, and as a consequence of that, learn and adapt and then grow and scale. So we really want to race as quickly as we can to scale what we are learning, but doing so in a focused way is a challenge, because you have to continue to come back to saying, okay, but is that the right next step? And so that's definitely one of the biggest challenges. You want to create really positive impact, but we got to stay focused, and then manage that tension is pretty tough.
And then segueing into your favorite part of your work.
Oh, the team. It's not complicated. I get to work with amazing people. I get to work with people that I enjoy talking to every single day, that I learn from all the time, with a stakeholder community that's focused on doing good work and creating positive change in the world. I feel fortunate to be able to do this work just about every single day. And even on the days when I know I'm frustrated and tired and all the rest of it, it's really easy to step back and say, well, I got to talk to all these wonderful people today, and I got to collaborate with them on trying to make things better. And that feels pretty lucky.
Thank you so much for your time. It's greatly appreciated, and your passion for your project, it comes through immensely.
Thanks for the opportunity. I am very, very grateful and excited to get some feedback on this conversation. And so start a conversation.
Thank you so much.
Thank you so much for listening. See you next month, where we'll explore another part of viruses, vaccines, and the immune system. We also want to know what questions you have. If you have any questions based on this episode or about vaccines, viruses, or the immune system in general, please reach out to us using our email, vaccines@sciencenorth.ca. We're always happy to address those questions. If you want to find out more, visit our website, sciencenorth.ca/givevaccines-a-shot. Also, follow us on Facebook, Instagram, and Twitter. And if you're listening or watching us on YouTube, please be sure to follow. Lastly, Give Vaccines a Shot is funded through financial contribution from the Public Health Agency of Canada. The views expressed herein do not necessarily reflect the views of the Public Health Agency of Canada.